Everybody. Today I wanted to talk to you a little bit about PPA, also known as primary progressive aphasia. So primary progressive aphasia is different from aphasia. It is a degenerative neurological disease. So language impairments, it does affect language, and these language impairments will deteriorate over time. That makes it different from aphasia, where you can typically improve at least some of those language abilities across the board. Additionally, the way it's different from aphasia is when you have aphasia, you usually have some sort of left hemisphere damage from either a stroke or a brain injury. But with primary progressive aphasia, there is no lesion required when you get a diagnosis of PPA. It's more that the brain tissue deteriorates. And that brain tissue is the tissue that we need for our speech and language functions to be intact. PPA usually occurs in individuals who are 65 years of age or older. But that doesn't mean that it can't happen when you're younger than that. A lot of times the symptoms start with having challenges with speech and language, but cognitive issues could occur a little bit later on, things like memory impairments or attention issues. But the first symptoms are usually with your speech and language. It is different from Alzheimer's disease. It is not the same thing, although it is a subtype of frontotemporal dementia. I wanted to just briefly talk to you. Now, there are 3 different variants that are associated with PPA, and the language functions and abilities look a little bit different for each of them. So I wanted to quickly review those and give you an idea of what those look like. So the first one is the agrammatic or non-fluent variant. Okay, again, these are all called variants. So there's 3 of them. Just a fancy word for types. So the non-fluent variant, the main thing affected is speech. And you will also have your syntax, as it kind of implies in the name, and your grammar is impacted. So those little functor words, those little connecting words in our sentences that help our sentences to flow and sound grammatic, usually that's an issue with these individuals. Speech might be sort of hesitant or effortful, and it's not uncommon for writing to have similar characteristics as their verbal expression. So writing may also look like their speech. Okay. And then lastly, they usually have pretty preserved auditory comprehension or processing abilities. So their ability to follow conversation is not as impacted as it can be in some of the other variants. So that's the first variant. The second one is the semantic variant. Whoops. Now, the semantic variant is a variant that the most common symptom is anomia. That's just a simple word for those word finding challenges that happen. Okay, so that's kind of the classic symptom for this one. And it's not only the verbal piece, but also the comprehension are both impacted here. So trouble going in, trouble coming out. It's not uncommon for the person with the semantic variant to exhibit paraphasias. So those are just, paraphasias are just a fancy word for word errors. Now there can be a couple different kinds. There can be phonemic paraphasias, which are like sound level errors. If they say fen when they meant pen, or semantic errors, when they might say pencil when they meant pen, or ink when they meant pen. So related errors, word related errors. But now in these individuals, the speech usually remains fluent and grammatical. So that's what makes it a little bit different from our first variant. And then lastly, our final variant is the logopenic variant. Now this one, the main challenge is phonological processing. So phonological is just a fancy word for our sound system. So trouble going in, trouble processing the sounds, syllables, words going in. So not surprisingly, repetition is impaired. This is kind of a key feature of this variant. Now, it's not surprising because if you have trouble going in, you have trouble processing what they want to repeat, they're going to have trouble also repeating it. So it's also not uncommon for these individuals to exhibit phonological paraphasias as well. So that was probably almost close to one, just those sound level errors. Now, grammar and comprehension are less affected, but speech is often a little bit slow in these individuals. So those are the three variants that are associated with primary progressive aphasia. Again, they all look a little bit different, present a little bit differently. But again, with PPA, usually these symptoms sort of become more challenging over time. I'm going to make another webinar where I want to discuss how we can help to maximize communication in these individuals and some options for treatment, because there is certainly hope in maintaining their current language abilities. I hope you liked what I talked about today. If you have any questions, don't hesitate to reach out, or if you want to learn more, you can always book a consultation with us. If you're interested in pursuing online speech and language therapy, we have flexible scheduling and intensive options as well. So you can always schedule a free consultation. Thanks as always for hanging out with me, and looking forward to seeing you the next time. Bye-bye.